Alrighty, so for today's overview, this is just an overview. It's a breakdown of what we will be covering in today's training. I'll talk about self-harm, the symptoms and the forms of self-injury, along with other types of physical self-harm and how to avoid aggression from others. Let me look over at this screen here. Also, I'll touch on what is known about suicide. That'll cover global statistics and also suicide rates in the US, followed by males and suicide. And what do you know? I'm sorry, or who do you know in this picture? So I'll show you a picture and I'll ask you if you know who they are. We'll also cover a little bit on the baby boomers, how they were affected by not having enough prevention during their times to prevent suicide awareness. Also, the suicide warning signs followed by PTSD signs and other circumstances that increase the risk for self-harm and suicide. Also, how age-related factors, loneliness, substance abuse um, affect um, these behaviors, along with, again, baby boomer generation and how they kind of trended the substance abuse during their era. And I'll show you a video on aging and addiction, how older generations are impacted by substance abuse and alcohol. And also at the very end, we'll go over prevention, how the media can affect or prevention in society if they kind of put it out there more on their headlines. And I'll wrap it up with the summary and resources and sources. So for today's introduction, self-harm is a behavior linked to a mental health disorder such as depression, PTSD, eating disorders, or borderline personality disorder. It is the leading risk factor for suicide, and it's a leading cause of mortality in the United States. Self-harm is an intentional act to physically harm one's own body. Self-inflicted injuries amongst older adults is the most alarming, especially for men over the age of 80. Suicide can occur at any stage of life and in all regions of the world. The highest rate occurs in older adults. This condition is also linked to alcohol or substance abuse disorders. And the strongest risk factor for suicide is a previous suicide attempt. Suicide is preventable, and it all starts with recognizing the warning signs. Majority of the time, suicide is a hidden problem. Increasing public awareness, using the media, and organizing educational events can save lives. So that's for our introduction. Now we'll go on to self-harm. Self-harm is when people deliberately hurt their bodies, which can lead to suicide tendencies. Once an individual makes their first self-inflicted attempt, that behavior is most likely to continue. Also, a common misconception is that the people who self-harm are all suicidal. Fact is, some people who self-harm, many never have suicidal thoughts. And it could be a suicidal or a non-suicidal intent. It all depends on the person. And some individuals may intent once, while others can self-harm for many years, and it could just be a continuous behavior, unless, they go and get some type of help and assistance. Why do people harm themselves? Can anybody want to share their thoughts and ideas on why this occurs? I'll look at here on my chat. Let's see, somebody's typing. Let's see what they say. Well, thank you for your feedback. I appreciate your participation. Well, let's see. People who self-harm have replied it's to, where is this page here? It's to relieve stress. It helps them cope with sadness, anger, and stress. It also releases a way to avoid their feelings that are overwhelming at the moment. And it also communicates their pain through a visible way. Communicate pain that they're feeling in a visible way. Also, the individual may feel in control by way of self-harm to punish themselves, purposely hurting their body to bring a sense of calm. It releases tension for them caused by emotional and physical pain. Again, like in the relieve stress box. And additionally, for others, um, it could be risk factors such as, they're probably could be involved in some type of substance or alcohol abuse, life issues, life itself, neglect, or living in an unstable family environment could be another factor, as well as any mental health issues going on, any traumas. That could be a reason why people hurt themselves. Now, going into symptoms of self-injury. Injuries may include in the following: fresh cuts, scratches, bite marks, or other wounds, excessive rubbing of an area to create a burn, keeping sharp objects or other items used for self-injury on hand, especially like for younger um, groups of individuals. You might peek into their, backpack or something, or see something in there that you notice that they're always carrying something sharp. That's kind of a giveaway. Also, wearing long sleeves or long pants to hide self-injuries during hot weather, especially like now in the summer. If you notice anybody's constantly wearing long sleeves and very heavy clothing, again, you might want to, like in this picture, take a look and see what's, going on, and see if you see anything that's kind of, you know, leading to letting you be aware that that person may be having this type of behavior. Also, participating in potential harmful risky behaviors or unexplainable bruises, difficulties in relationships with others. You might start to see the person, having a lot of challenges, communicating or abruptly getting upset. Behaviors and emotions that change quickly and are impulsive, intense, and unexpected. Or they may start talking about being feeling helplessness or hopelessness or worthlessness, right? And remember, self-injury mostly happens in private. It's usually done in a controlled manner, the same way each time. So pay attention to the patterns. That's very important. And then other forms of self-injury or forms of self-injury. Cutting is one of the most common methods and the most frequently seen on the arms, legs, chest, or belly. There could also be scratching or stabbing with a sharp object. Burns. They could be making burn marks with lit matches, cigarettes, or some type of branding on their skin, again, using heated objects. Um, Self-injury is also caused by carving words or symbols on their skin, piercing the skin with sharp objects, or inserting objects underneath the skin. Now let's go ahead and move on to the next slide. There's more. And these are other types of physical self-harm. Um, we already covered the first two, which is the cutting and the burning. Another form of physical self-injury would be skin picking. It's called dermatillomania. This is when a person with this condition habitually and excessively picks or scratches or squeezes at their skin when it's otherwise, healthy skin. Also, hair pulling, trichotillomania, that's a name for it. This can be a mental health disorder. It's an irresistible urge to pluck out hair strands from the scalp, and along with other hairs on their body, such as the eyebrows or other hairs like on their legs or so forth. This is also another form of self-injury. And punching or hitting. For some individuals, the release of tension and the act of aggression when they're mad is said to be stress relieving. It's a form of venting. And head banging. It's often a repetitive or compulsive form of movement, like such as banging one's head against a solid object. Again, banging their head against the wall or door. It's a form of stimulation to relieve stress. So this is what people who have these behaviors have mentioned. And how to avoid aggression from others. This is really important because you might be in a situation where things can escalate pretty quickly. And if how to, keep calm, try to, present a non-threatening stance, communicate, use open body language, respectful eye contact, and active listening, and be understanding. Put yourself in their shoes, in their situation. Let's just show some empathy, that we understand and we care, but also set boundaries. Clearly define expectations and consequences to help people manage their behavior. And whenever you feel that you are in danger, do not hesitate to call 911, or if there's another bystander or something around, call out, and let them know that you need help. This is in case you ever find yourself in such situation. You got to know exactly what to do because, like I said, things can escalate quickly, and we all know when we are in that fight or flight, sometimes our brain gets a little foggy. So as long as you practice this, and you should be able to keep yourself safe. Now we're going to go into what is known about suicide. Well, we know some individuals seem perfectly fine with no signs and symptoms of distress or depression, right? And also many individuals may not even think about their loved ones committing acts of self-injury or even know it's an existing issue. Also, suicide rates, again, are the highest in late life for those age 65 or older. And this is very important to remember. A prior suicide attempt is a clear indicator that that person is a high risk factor, and they will most likely continue with this behavior unless they get help. Okay, here for global statistics, I don't know where the top of my heading went here, but anyhow, Um, this slide is just on a global scale. More than 700,000 people die every year due to suicide. That's one person every 40 seconds. That's pretty significant. And on a world scale, older adults again are leading on the global statistics. Um, Males have a higher rate of suicide than females, and this is all across the globe, right? So now we're going to go into statistics here in our own country. Oh, let me go back. I wanted to make a key point. So here on, my question is for you is, why do you think men have a higher rate of suicide? Well, one key element is communication. It's simple to say that women are willing to share their problems and men tend to bottle them up more, but in fact, that is true. For generations, many societies have encouraged men to be strong and not admit they're struggling. And at a very young age, they're conditioned to not express emotion because to express emotion is to be weak. We we've all seen that scenario, and I always say this, like when you're at a park or like in a playground area, you always see little boys that fall down and get hurt and, they cry. And the first thing that the parents and the siblings do is come over and say, hey, boys aren't supposed to cry. So, like I mentioned, at a very young age, it's probable that men are conditioned to not express emotions. So that might be the reason, again, that males have a higher rate of suicide than females. And for suicide rates in the United States, well, suicide rates are high and they're rising. They keep rising. Um, in our country, seniors have a higher suicide rate compared to other age groups. And there are more than 49,500 suicides in our country. And out of that, 10,433 were attributed to people ages 65 and up. In 2023, suicide claimed over 50,000 lives in the United States. It's the highest number in American history. And again, the numbers keep rising. If we look at this graph here, we can see that individuals 70 years and older have the highest rate of suicide. And we'll kind of get into that a little more. Um, Again, and then as the age group drops, they have more attempts, but they have less suicides. And then we'll kind of get into this other screen that shows us why. So on this screen, suicide attempts. Older males die by suicide more often than any other group because they use more lethal means than when attempting suicide. So if we look at the comparables here, we can see that out of 3 older adults, 70 and above, out of 3 attempts, there's 1 suicide compared to the youth group. Out of 200 youths, out of 200 attempts, I'm sorry, there'll be 1 suicide. That's pretty significant in comparison, right? So here we understand that older adults have less attempts, but more deaths compared to the younger groups. That's why in the previous slide, we've seen that the numbers were much higher, and this is the reason why. There's less attempts, but there's more outcome. And also men age 80 and older tend to plan suicide more carefully. Just like in the orange words here, they use more forms of lethal weapons. Usually, older men or men in general tend to own firearms. So a lot of these suicides are done by firearm. And also males are also more likely to use, again, more lethal methods. And do you know who they are? Does anybody know who these individuals here in this picture, who they are? Well, for one, they all happen to be baby boomers, right? Um, and baby boomers, they were the largest generation group in 2022. Baby boomers' estimated population was 72.24 million, and I believe now they're outnumbered by the millennials. And baby boomers had the highest rate of suicide. And in this picture, I believe it's Michael Jordan, Bill Clinton, Oprah Winfrey, and Steve Jobs. And baby boomer is just a term used to describe a person who was born between 1946 and 1964. Now let's talk more about the baby boomers and self-harm and suicide prevention. In 2008, the economy downturn um, occurred, and a lot of older adults, ages 45 to 64, had the highest rate of suicide. During this time, it was their prime years. Um, there's an association between suicide and loss of financial stability. During their prime years, baby boomers, this was their wage earning years, and it was affected by the loss of the financial stability that happened during that era there. And a lot of them showed warning signs such as withdrawal or signs of substance abuse, loss of independence due to aging. They were also aging during that time. And when they began to withdraw from others, people didn't think much of it. They saw the baby boomers as being super resilient. And, when they kind of just had a withdrawal a little bit, they thought they were just tired of working, most of their life. And they didn't see this as an awareness. And the miscues, again, They were seen in their prime as being very resilient, and the assumption that they didn't contemplate suicide. They were seen as very confident. I never crossed their families or their friends' minds that baby boomers were perhaps contemplating suicide or that they were going through a lot of distress because of the economic downturn, and also they were aging. This is when their aging process started to kind of kick in, and they weren't able to do a whole lot of what they used to be able to do, such as, work and be super active, and also suicide prevention. At that time, prevention programs were more directed towards the youth. More awareness was needed for older adults, and unfortunately, this wasn't really offered to the baby boomers, so that's why they had such a high rate of suicide at the time. Now we're going to get into suicide warning signs. These are some of the signs people fail to observe in the baby boomers. So suicide warnings, when a person starts talking a whole lot about the great guilt or shame that they feel, or they start to express that they have no desire to live, or they start to feel like they're a burden to their loved ones, that's clearly an indicator that something is going on. And depression can, make a person start feeling empty, perhaps trapped, or in extreme sadness or pain. Um, Also a change in behavior. You'll start to see, again, like the warnings for the baby boomers, the person starts to withdraw, or they may start giving their stuff away, very important items that they cherished and they couldn't think of ever departing with it. That's another sign. Another indicator would be substance abuse, an increase in alcohol or medication abuse, or an attempted prior suicide, self-harm. Those are clearly indicators that the person is feeling some type of depression, and these are warning signs. And now we're going to discuss a little bit about PTSD. This is a mental health condition. This is where a person witnesses or experiences a traumatic event. It affects a person's everything, right? So we're going to look at here what the symptoms are. So PTSD is a mental health condition that can develop after someone experiences or witnesses a traumatic event. It can affect a person's mental, physical, social, and spiritual well-being. That's why I said it affects a person's everything. And the symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. They might have difficulty being around a certain group of people or just people in general. Um, they kind of just tend to be kind of on their own, or maybe if they trust a person, they'll feel comfortable with that person, but it's a little challenging for them to be around large groups of people. Also, with certain mental health disorders, people may display acts of aggression or verbal or hitting when they're upset. How do you deal with this? Again, like in the previous slide, know your protocol, what to do in a situation like this. If you ever find yourself in front of someone who's aggressive or is having a moment, walk away. Resist the urge to even retaliate or mention anything, say anything back. Set boundaries, and again, call 911 if you feel that you are in harm, or get counseling, or the person who is displaying that they are having a moment of a mental crisis, perhaps even discuss that with them, try to find them some help, or something that can help them with their situation to de-escalate. And here we can see PTSD. How common is PTSD? Well, about 7 to 8% of people will experience PTSD at some point in their lives. So that means me, that means you, everyone, right? However, we're not all going to show the same symptoms. Everybody's different. But PTSD is more common in people who have experienced multiple traumas. Also, first responders such as police officers, firefighters are also at high risk of developing PTSD. And 7 to 8% of people, women particularly, are twice as likely as men to develop PTSD. Also, people with military experience, veterans, are higher risk for developing this condition than the general population. And about 1 in 3 survivors of sexual assault will develop PTSD. These can all attribute to, you know, self-harm and possible suicide thoughts. So now we're going to get into this slide here. And other circumstances that increase the risk for self-harm and suicide. Well, let's see. It could be a loss of a loved one, usually a spouse or a death in the family. Um, that can also trigger an increase. Loneliness, if the person suddenly begins cutting back on social interactions, neglects their self-care and grooming, that's a warning sign there. Males, particularly Caucasian men, are at higher risk. Also, aging is another age risk factor. Adults, again, over the age of 65, they're tired of dealing, some of them, with chronic constant pain or illness or disabilities. And chronic illness, adults with severe health issues, or feeling like they're a burden on their family because of their situation that's changed from who they once were. They were independent, now they got to rely on other family. They could be feeling that they are a burden for their loved ones. And mental health disorders, anyone who has depression, bipolar, and what we just went over, PTSD, those can also be an increased factor. Substance abuse, the use of alcohol or pills and other substances. And genetics are biological traits. So, for many of the baby boomers, that they displayed all of these risk factors here, and they were a very high risk for suicide. Nobody really took it for heart, right? So now that you see these here, remember these signs here, because anything that's on this slide, any of these can affect someone's risk for self-harm. Okay, so now we're going to get into age-related factors. As you may know, age plays a significant part on our mental health. It's because as we age, everything about us changes, particularly our brain. And these changes occur at different rates for everybody, right? Some of us age sooner than others, and these are physiological changes. So now let's get into age-related factors. So physical decline. With age, bone and muscle mass shrinks, so you lose flexibility and endurance. A lot of older adults are less likely to do the ordinary things they once did with ease. They're less independent. They need more assistance from others when, they lose some of their physical health. And also cognitive changes. Again, the brain changes as we age. Multitasking gets difficult due to short-term memory loss, and we tend to probably start to be forgetful, or other individuals may develop dementia or Alzheimer's at particularly like a younger age, 50s and 60s. And age sight as well. At age 40, your vision begins to decline. Aging affects your eye lens, causing cloudy vision called cataracts. And along with our eyesight, our hearing also changes. It diminishes. We might have difficulty following a phone conversation, or in general just conversations in loud crowds, right? Particularly phone communication, that gets very, very difficult as the hearing, declines. And age-related stress. This is one of the things that happen to the baby boomers as well. Um, Less stable family, or lack of social support, economic insecurities, chronic or mental health illness. Elderly individuals are on fixed incomes, right? A lot of them probably aren't able to work or work full-time jobs. They might start to struggle financially, or extended family may move away, leaving the individual pretty much, living in one state on their own and their family moved to another state. Also, difference in generations. If grandpa's left with the younger generation, like the great grandkids or grandkids, they might be at school or working double jobs, and it's not that grandma and grandpa are feeling neglected, but the elderly population, I'm sorry, they will start to, get depression due to feeling neglect. And any life-changing event due to aging is a big age-related stressor. So all of these things kind of tie in to start feeling depression or any type of PTSD involved, or like we mentioned, mental health, genetic traits. All of these can contribute to self-harm and suicide. Another factor is loneliness. With loneliness, um, the older population are starting to live longer, right? And many of them are starting to outlive some of their relatives and friends. So for the elder population, they're growing, right? Their population is growing because of better health care and better medications, and they're more proactive with their health. The elderly experience more depression also as a result of living alone or for longer periods of time. Like I mentioned, a lot of their friends or families may go before them, and they're kind of like the last ones left. So that kind of can bring on depression. And many outlive their spouses. That's a tough one right there. Their friends or family members. Sorry to be a little repetitive. Also neglect. Oh, and it's much more difficult also. It's much more difficult to start new friendships as you age, or new networks as compared to the younger generations, right? So a lot of the older individuals, when they have friends and family that they've known for years and all of a sudden, they start to go, this can start to make them feel very lonely. Neglect. People can still also feel lonely despite not actually spending much time alone. We've all seen movies, where everybody gets together, I guess, for the holidays, and grandma and grandpa are kind of sitting, you know, on their own, and the younger crowd is, more engaged in their conversations. So even though our family and relatives are older adults and they may be, you know, in a family setting, always make sure that you call them over and have them participate in the conversations, even if they have hearing problems. But I think that a lot of the times, older individuals might start to feel neglected if they're in a setting with much more younger individuals from a younger generation. And lack of close friend ties leaves older people to be less connected socially, and older adults are seeking to be listened to and to contribute to society. So, if you are living with grandma or grandpa, or you have like um, a patient or someone that you care for, have them participate in anything that you're doing in the home. If they're still able to move around, have them throw out the garbage or have them put dishes away. Anything that will help them still keep their independency is very important. And how to overcome loneliness? Well, make strong connections with older adults in your family. Make them feel appreciated and useful by having them again help with any tasks around the home. Invite them if you don't live with them, they live in their home and you live in your home, call them up sometime and, have them meet you somewhere for lunch or to get a cup of coffee, and just to spark up a delightful conversation. Anything helps, and anything will let them know, that They're very much involved still. And now we're going to get into substance abuse. When substance abuse comes to mind, I can never imagine my 88-year-old grandfather dealing with addiction. And this is because there's always that stigma, right? That teens or the younger adults are more susceptible to drug addiction than adults are. However, older adults can be more prone to substance abuse behavior problems. And many older adults not only deal with life stressors, like we just mentioned in the previous slide, as everyone else, but there's also a combination of factors that we just covered, like aging and, mental health crisis and, you know, neglect and the disabilities and, the loss of independency. All that is a double, triple whammy for anyone who's over the age of 65. So now we're going to look at here on the slide. So alcohol is the main increasing addiction for those age 65 and older. And prescriptions, these are opiates. It's the second most abused medication, whether prescribed or not. And depressants, those are in the benzo families. That could be Valium and Xanax. These are downers. And stimulants, these are controlled substance that are very addictive, such as Adderall, Concerta, and Ritalin. However, I believe that these are I believe they're mostly given to children that like display signs of or have conditions with ADHD and so forth. So for the alcohol part of it, more than 10% of individuals who are 65 and older, they are binge drinkers. And that means they have 5 or more drinks within the same 2-hour period. That's a binge drinker. Also for women, and this is for women of all ages, they binge drink by having 4 or more alcohol drinks in a 2-hour period. So you can see clearly that men consume more alcohol if they're binge drinkers. It's 5 or more drinks within a 2-hour period. And for prescriptions, most of the times these are not very difficult to get. A lot of the time, they can get these prescriptions from their doctor and just self-medicate and take more than they're prescribed, as well for depressants or stimulants. All these, they can get them. They're accessible from their medical doctor's office. And older adults who experience substance abuse related issues have said it's to help them cope with either chronic pain, physical limitations, and disability that they might be having some challenges there. And if they're transitioning living, meaning if they're moving from their home to a skilled nursing facility, or if they're temporarily homeless, a lot of these individuals may be using substance abuse kind of like a way to cope and not really deal with the issue. And also not being able to consume a proper diet. Um, Times are really difficult nowadays. People might be struggling financially. They might not be able to purchase sufficient food or even be able to buy healthy foods. So poor health, also due to poor health, they can be very vulnerable to not being able to cook on their own. So if they don't have anybody helping them, you know what? They might just start drinking or maybe take a pill to kind of get over their hunger. It's kind of crazy to say that, but it's a fact. Also, when older individuals are forced into retirement and they're not able to work anymore, um, and they lose their usual routine, a lot of older individuals might turn to substance abuse because, adapting to new life changes in late life is difficult. And like we mentioned earlier, also feeling lost, helpless, or a loss of independency all this can lead to depression. So again, now we're going to get into the baby boomer generation again. Remember, they had the highest rate of suicide in our history. And in 2012, the National Survey on Drug use revealed the use of illicit substances doubled on an average among those 50 to 65 years of age between 2002 to 2012. And substance abuse is a complex problem in the elderly population, and they were the most affected, again, the baby boomers. So a statistically significant increase in substance abuse driven by the baby boomer generation. It was kind of a trend setting for drug abuse and older adults. It kind of all started there. Baby boomers have been reported to have the higher rates of substance abuse than any previous generation. Also, many U.S. veterans aged 50 or above may be dealing with substance abuse as well. So here I have a video for you, and this video relates to the material we just covered on substance abuse, right? So we'll go ahead and play it for you. Okay, very well. Now we're going to get into prevention. There are steps that we can take to raise awareness. And this training was presented because there needs to be more awareness towards self-harm and suicide prevention. As we learned, the baby boomers kind of suffered on that end because they didn't receive the help that they needed, and there was really no awareness or much out there for them to seek help, right? So this is why we're presenting this training, is to, let you know that there are steps to raise this awareness. Let's support our mental health in our community. Let's join a race, some type of cycling or triathlon when, we hear about mental awareness. Also joining an event during National Suicide Prevention Month. That's in September and it's actually coming up. Join an event. This will promote like the media and also, people wanting to see what the commotion is about, and letting people in our community know that this is important. This is, prevention, a form of prevention. And also get the media involved on any upcoming events to spread the word on older adults with self-harm and suicide prevention, particularly for those, in the older age group, 65 and above. And so promoting, how can we do this? Well, more awareness about older adults and suicide prevention in your community. How do we improve this? Well, older adults health and mental health services. There needs to be caregivers and family members with more information and skills regarding the risks related to self-harm and suicide, like in this training. What are the signs? What is the what's the awareness? What is the prevention? So all this ties in together. And also suggestions. Suggest that your older adults get depression screenings regularly from their medical provider, and know the 4Ds of suicide risk in the elderly: depression, disease and disability, disconnectedness, and the deadly means, which are firearms and pills. If you see that you have a loved one or a friend that is showing all these signs and you know that they have a deadly firearm and they're consuming pills, just keep an eye, monitor the situation so it doesn't escalate, and provide education on factors associated with increased suicide risk. Ask questions related to substance abuse, alcohol addiction, or other substances that you see that they might be using. Provide older adults with resources and referrals to rehab or treatment centers. Also encourage those with mental health crisis to contact the suicide prevention hotlines, and to get in touch with any referral advocacy programs in their area, and communicate. Remember to offer support by listening to that individual's needs and assist them with referrals or other resources. Communicate effectively with them and their family to eliminate or limit access to any means of suicide. Again, sharp objects, firearms, pills, poisons, and so forth, to prevent a tragedy. And also the problem of suicide in late life is often neglected by medical professionals, policymakers, and the general public. Although suicide is more common in the elderly than in the younger people, suicide in old age does not attract the same interest from the media or investigators or policymakers. Remember, media coverage rarely informs the public on any elder suicide prevention. It's not their main focus versus, the younger groups. Of course, unless it's an important figure, a celebrity, then that's when it makes, mainstream in the headlines. So let's get the word out there: awareness and prevention. So to tie up everything for our training today, let's review what's on our summary. So self-harm is a high risk factor which leads to high mortality rates for suicide both in our nation and around the world. Primarily, men over age 80 have the highest numbers of suicide rates. Aging individuals with mental health disorders, in combination with all the risk factors that we covered, such as the age-related health conditions, loneliness, substance abuse, these are the major contributors that make the older adults more vulnerable to suicide compared to the younger general population. And today we also focused on the warning signs, the symptoms, and the forms of injury which leads to self-harm and suicide itself. We learned about the baby boomer generation and how they were the highest group impacted by the lack of suicide prevention. And also, it's a known fact that suicide prevention programs are mostly directed toward the youth. The media and society are less focused on promoting suicide awareness directed towards the elderly. And the key point here is suicide is highly preventable. We just need to really keep our eyes open for warning signs or anything displaying depression, PTSD, or anything like that, and anybody who's had a previous suicide attempt. So please keep an eye on that. And thank you today for attending. And here's a little quote here that I seen: pain isn't always obvious. Know the signs. Suicide is preventable. And my resources for this training, September, remember, it's the National Suicide Prevention Awareness Month. Here's a National Suicide Prevention Lifeline. Anybody comes to you with any concerns, refer them to these suicide awareness lines. There's also the Veterans Crisis Line, I believe the 966 Suicide and Crisis Lifeline, and then here in San Diego, the 211 San Diego connects people. Also, the Salvation Army has an adult rehabilitation center, and they have walk-ins for anybody who's dealing with substance abuse. And I believe it's particularly it's for men, but because they have like a rehab center for men here in, I believe, in Otay, California. And these are the sources where I did my search on today's training. So thank you very much. I highly appreciate you taking the time to take this training. Remember, we have many more trainings scheduled, so go ahead, feel free to sign up for them. And thank you so much and have a wonderful day. If you have any questions, I will stay online for a few more minutes. Thank you, everyone.